I was trying to think of the most precious thing we have in this world, so I was going to say the MFP is like sitting on a gold mine, or it's like having unlimited diamonds, but I see this program as something that truly is more precious than any natural resource that we could ever think of. This becomes an intellectual home for people, a cultural home, a social home, an outlet, a place of advocacy. And when we look at the supports that we have at our institutions, even if we've had the best academic experience and trajectory, there's nothing like being able to be in a room with leading clinicians, scholars, leaders, influencers, there's no other way. I think that we get this number of people together, coming together around that shared goal of increasing diversity in all aspects of the workforce, in all aspects of, patient care, research, education. So I am so grateful and will forever be grateful to this program for setting me on the course that I'm on. I can say wholeheartedly, without a doubt, I would not be Dr. Bridgette Brawner without the MFP.
They helped me get through school. Without MFP, I couldn't have done it. I was working 7 days a week for 13 years to pay my way through school. And at times even helping my family financially as a student. Since 2023, my practice has served 11,993 patients. And maybe I haven't seen all of them, of course, but because of me opening this and the wonderful providers I have, that's how many patients directly. And if you multiply that number by 3 to 4 to 5, because of the ripple effect it would have on their children or their family, that's a lot.
I hope that as the program evolves, what it is never taken for granted, because it's very easy to say, oh, well, it's a fellowship program. Oh, it provides financial resources for people who are training in behavioral health. It's so much more than that.
I'm one of the only ones. Usually the Hispanic psychiatric nurse practitioners that people travel to because they don't have anybody that they can communicate with. And I know that even though I'm one person, I think I have the power to influence children and people that look like me, and I'm getting emotional, to let them know that they can do it just like I did. And that's one thing that I've felt this whole time I'm here. I'm looking around the room and I see people just like me. So very proud to be here, and I'm thankful.
I've had patients refuse treatment until they saw my face. Refuse treatment that could potentially be life-saving because of the mistrust that's been instilled and ingrained in us because of the mistreatment that we've, received over the years. But literally refuse life-saving treatment until they saw my face, a face that looked like theirs.
Our big topic for this year's institute was racism in healthcare and how to address that, and that's such a huge issue, especially as America becomes more and more diverse and there's a lot of more talk about racism or microaggressions, different things like that. I myself, as a health professional and as a student, sometimes don't know how to go about talking about it, even though I have training and more, cultural competence. It's not something that's going to be fixed quickly, but knowing how to talk about it and what steps we can take to address it and how I can incorporate that into my patient education in the future as well, that has been helpful for me because I didn't receive that in my education.
Who's going to be the first mental health nurse in outer space? I want to see nurses in NASA. And so I'm looking to see who among this group is going to be.
You can use all technology for evil purposes. Yes. But my thing is you got to get in there and we have to get in there and program the voice of nursing. No, I'm big time in AI. I'm on some of the research panels and everything, trying to make sure we have to be at the table. Here's the thing, there's not a lot of black and brown people in that space. Exactly. And so we need more technology-driven, digitally driven scientists. Because that's where the world is going. Remember, by 2050, we are going to be in a severe situation in our country and the world when it comes to the future of education. We're going to have a whole lot of different things happening because we won't have enough population, I'm just going to use, for example, in the United States of America, to even do the work. So they're going to create the machines and everything, just like some of these crazy movies you see. This stuff is going to be real. You'll wake up one day and you'll have a little person that comes to you that's not real and say, it's time now, Stephanie. You know, so I'm embracing it. I want the robot dog. I want everything.